GBCHealth Business Action on Health Award for Application of Core Competence. This award honors outstanding programs or enterprises that apply core business skills, networks, products, services, or other assets to address health challenges.
Please welcome the Vice President of Health and Chief Medical Officer at BP, Dr. Richard Heron.
Well, good afternoon, ladies and gentlemen. It's my great pleasure on behalf of GBCHealth to present the Application of Core Competency Award for 2013. As a physician and Vice President for Health at BP over the last 6 years, I've been delighted to see the evolution of GBC from HIV, AIDS, TB and malaria through to the wider health spectrum and the Millennium Development Goals. For companies, and certainly for multinationals, there is undoubtedly an impact of these important challenges. What their motivations are may vary, whether we become involved through management of risks to employees, those who travel, whether it's the need for a healthy and workforce who are productive from a local population, or whether it's part of a CSR strategy, corporate social responsibility strategy and shared value. It matters not. We all have the opportunity to improve health for business and mutual benefit. So it's with that in mind, it's my pleasure to really present awards of where business can give back based on the skills that they have. Successful businesses depend on logistics, supply chain management, financial skills, project management. And many of these capabilities are exactly what is needed in terms of improving health in communities. Now, competitors in this category, Application of Core Competence, represent a broad range of industries, but they have all found the opportunity and have taken it to deploy their key business strengths and advance global health. So this year, I'm proud to commend the Best Doctors, Inc. for its interconsultation program. Unfortunately, they're not here to pick up the award, an award which really has improved access to diagnostic capability and is rolling that out on a wider scale. But I still think we can congratulate the Best Doctors, Inc. in any case. Now, I'd like to now turn to the commended award for Pfizer, and I will shortly be asking for Una Puglisi, Corporate Responsibility Senior Manager, to accept the commendation for this award in respect of their Global Fellows Programme and what they've done to increase the access to business skills, supply chain management, and disease prevention activities through that Global Fellows Programme. Una. Turning to the category winner, for many of the world's rural poor, access to adequate healthcare remains both financially and geographically out of reach. Well, this company decided to tackle both issues in tandem, focusing on those living at the base of the pyramid in rural India. They provided education to millions of villagers, strengthening the technical skill sets of tens of thousands of rural doctors and healthcare workers. Pharmacists as well, and improved the supply and affordability of medicines, improving healthcare access to an astonishing 42 million people. Perhaps more incredible is the true strength of the program in that it is replicable both inside India and outside. Its success there has led to programs being introduced in Kenya and Vietnam also. So I'm very proud to announce the winner of the 2013 Application of Core Competence category is Novartis for its Arogya Parivar, or Healthy Family Program.
Over 2/3 of Indians live in rural villages. For those 740 million people earning less than $2 a day, access to healthcare remains an issue. Arogya Parivar reaches the underserved millions living in rural India. The program focuses on the diseases most prevalent in rural India. Products have to be simple to use, available in smaller packages, and affordable to rural populations. After just 3 years, Arogya Parivar is now serving tens of millions of people living in more than 30,000 villages across India. Through Arogya Parivar, Novartis is expanding access with a sustainable business model that educates the community and empowers patients to take healthcare into their own hands.
So could I ask the head of Social Business Group, Anuj Pasrija, to accept the award for Novartis?
Thank you, GBC, and the judges for acknowledging our good work. And I'm honored to accept this award on behalf of my team in India from Arogya and Novartis. Since we started this initiative in 2007, it has already improved the medicine access for 42 million people across 33,000 villages of India. And in fact, it set the new standards for social initiatives in healthcare sector. Novartis, I think, is making a very significant contribution by providing healthcare access through the affordable quality medicines, especially in the bottom of pyramid and developing countries where usually these people are underserved and unreached. Our medicines, of course, reach almost 1 billion patients plus each year, but there are 7 billion people out there in the world. So we have a long way to go, but we are fully committed to improving the access further for the poor in the villages by scaling up this initiative across some other parts of Asia and Africa. So thank you so much for encouraging us, and we are committed further to do better. Thank you.